Good evening, everyone. My name is Ajiri Ejoni, and I'll be telling you about a life of an athletic trainer. Many of you in this room have been a former high school or collegiate athlete, one of many that have had a ligament in your ankle that was torn while running or landing wrong when you made the last shot at the buzzer to win a game. Others have pulled a hamstring. Who can help you with both these sudden injuries? I can tell you, it will be an athletic trainer. An athletic trainer goes to a four-year university to attain his or her bachelor's in kinesiology or sports medicine, then attending a master's program that is 2 years where they will complete clinical hours and also lab hours. They will take the state board exam to get their license as well. I had a pleasure in talking to a head athletic trainer in the dance department at the University of North Carolina at Greensboro, and her name is Emily Morris. To all my collegiate athletes, how many of you have had an acute or an on-site injury before? Now, when seeing the athletic trainer for your rehabilitation, did his or her treatment help you in your return to play? Having a certified athletic trainer at any sport event site has saved so many non-life-threatening and life-threatening situations. Being a certified athletic trainer requires a lot of patience and being very conscious when treating players. But athletic trainers are usually the first responder at any given event. Duties of an athletic trainer comes with proper skill, training, liability of care, and efficient communication with the coaches. You guys are probably wondering what proper skills an athletic trainer needs, but besides just wrapping ankles and taping wrists and putting ice and heat in areas that are needed for treatment. There are a lot more detailed and tedious duties that has to be done before wrapping ankles and applying ice and heat. Let's take a deeper look at proper training skills that are required from an athletic trainer. We'll start with diagnosis. It's approached when the athletic trainer, after an injury, whether it was an acute or an on-site, does a detailed evaluation on the injured area to identify what is exactly wrong with the patient. It comes with a series of questions, observation of deformities, and performing special tests. One of those tests is knowing the mechanism of injury. Well, Emily told me you have to listen to your patient even though you were not there at the time of the injury, and listening to your patient will help you paint a picture. Also, she even stated that you have to palpate with a purpose. That means feel for structures and conducting mental gymnastics that include review your anatomy, pay attention to the patient's reaction. So after all of those steps, we go into treatment. Immediately a few days after the injury to start the rehabilitation process, the amount of treatment is dependent on the severity of the injury. The use of tools and equipment. Being an athletic trainer, they work through a variety of scenarios in order to make the correct decision for tools and equipment. Now following that are the therapeutic modalities that I told you earlier of ice and heat. Ice can be used for both acute and chronic injuries. Heat is used only for chronic pain or injuries. Heat should be used before practice as a way to heat up the muscles that are tight or have chronic pain. Ice should never be used before practice unless there is enough time to allow the tissues to heat up. Usually you need an hour before, so 20 minutes of ice, 30 to 40 minutes of heating the tissues back up. Ice should be used for a post-practice / activity for pain, soreness, and swelling. Now, we're gonna go in more nitty-gritty of athletic training, liability. What is liability, you may ask? Liability is a state of being legally responsible for a situation. As an athletic trainer, a first responder, they are held responsible for the care of an athlete, no matter the life or non-life-threatening situation. We'll take a look at what different types of liability issues that are common in such sports. First, negligence. The failure to do what a reasonable, careful, and prudent person would do in the same situation. Another one, malpractice or malfeasance, a form of tort which is a legal committed wrong against a person, or an act of commission, an action that violates a legal duty. I was told from Emily, how would you handle a liability case such as this? Well, you can contact your lawyer, check your liability insurance, and document incident with as much detail as possible. I'm gonna give you an example. An athlete that returns to play early. Return to play is primarily the decision of the athletic trainer or a team physician. At times, parents and coaches might influence the athletic trainer that an athlete is ready to return on the court or on the field. Even though certain individuals may be involved in the athlete's return to play, but to avoid liability situations and confrontations, by law, the athletic trainer has the final say. According to the National Federation of State High School Associations, recently the NCAA ruled that athletic trainers and team physicians should have the final decision with regard to medical management to return to play, RTP. Decision related to student athletes following injury or illness. This ruling governing NCAA member school specifies that a coach cannot dismiss or override the decision of the team physician or the athletic trainer. It also creates a foundation of administrative structure within the athletic department where the sports medicine program is free from the influence of the coach, thus protecting the student athlete and the athletic health provider when making return to play decisions. Let me give you an example. There was a time when the athletic directors would support a coach over the opinions of the athletic trainer or team physician because the coach knew the player better than the athletic trainer. Since the coach had daily contact with the player, there was a belief that the coach was in a better position to judge the ability of the player safely, participating based on the daily contact. Now, we're gonna go in more how do you communicate effectively between athletic trainer to player and athletic trainer to coach. Certain things are privacy of the player to protect his or her rights from being disclosed unless otherwise. I can tell you that communication is a major role in this profession such as this. It brings forth a sense of trust that a player and coach should have with the respective athletic trainer to make sure each one is up to date on progression and trust of players' confidentiality. We'll be hearing from the athletic trainer herself to give you more insight of efficient communication. I'm going to go over with you HIPAA. HIPAA is Health Insurance Portability and Accountability Act of 1994. It was established as a national standard for electronic healthcare transaction. It protects individual health information and improves the effectiveness of the healthcare system. As follows, confidentiality is one of the patient's history, assessment, and care provided. Most importantly, it cannot be discussed with anyone else who does not have the written permission or is not involved in immediate care. This comes from Emily herself. Most athletes sign a waiver at the collegiate level allowing the coaches to know what is going on. However, if a waiver has not been signed, you need to get a consent from the athlete divulging any information. If they do not get permission, then you need to explain to the coach that you are not legally allowed to divulge information from the athlete. But you are welcome to ask the athlete themselves or explain what the athlete can and cannot do at practice without stating medical reasoning. Having to communicate effectively between players to coaches from the athletic training standpoint, Emily says, communicating in an assertive voice, which allows her to get her information across regarding the athlete, but also show her empathy for the situation. And you have to speak clearly in words they understand and ask them if they understand as well. It is a constant back and forth, checking and adjusting treatment as needed. Also, an athletic trainer to coach, trying to track the progression of the player, is dependent on the injury. With an acute injury, especially second or third degree, daily communication is crucial for treatment and pain management. Chronic injuries don't have to have a daily communication, but should keep in contact on at least a weekly basis, as long as they are doing their outside work with exercise and rehabilitation. Overall, we've heard the important concepts of the life of the athletic trainer, from her proper skill training, with the use of tools and equipment, and the use of therapeutic modalities, and most importantly, how to palpate efficiently. And don't forget how to communicate as well. We also talked about liability and how liability is handled if improper care has been administered to an athlete. As though there are more in-depth details discussing a player's confidentiality, that goes along to inform future athletic trainers like myself to understand more than just a general overview that goes along with the job itself. With that being said, I am pleased to inform you with a brief overview of what a day-to-day life of a trainer will be. Oh, excuse me, I'm busy, I have to go.